is Arshad Karim. I'm an oral and maxillofacial surgeon from El Paso, Texas. I think the most difficult situation that you are in is basically when you're faced to see an explosive injury, especially that with my field is relating to the field, related to the face, patient coming in with soft tissue injuries of the face and loss of lip, cheek and other areas of the face, and also the jaw, the mandible, the maxilla fracture. And the difficulty that I face is like, how do you provide definitive treatment? And that is very difficult. I think we have to stage the treatment. We don't have enough supplies. We don't have the equipment. I think the best that we can do given the situation is basically damage control surgery to provide the best care that we can given the situation and given the resources, and then wait for a second stage where we can provide definitive care. I don't think any region or any nation would be prepared for a catastrophe like this, to see this many patients with such horrific injuries. I don't think that anyone would be ready for such a long time, and especially Gaza, a poor region. They don't have resources to begin with, and especially with current situation. Since nothing is coming in, I think the lack of resources makes it really difficult to provide healthcare to the injured patient that are coming in. And also, they're not just injured patients, there are other patients who are affected by this ongoing crisis because of being displaced. They're hungry, they don't have shelter, they don't have food, they don't have water. So all that combined, I think, and the healthcare workers are not shielded from this. I mean, they are also being displaced. They are also living in tents and coming to work to provide care. So I just see that it's really difficult. It's a very difficult environment to work. The time that I've been in Gaza, it has been a very surreal experience. I have seen basically injuries from building collapse, shrapnel injuries, and along all spectrum of ages of patient. And I've seen that the hospital is overwhelmed. The healthcare workers are overwhelmed with the amount of patients that are coming in and the amount of injuries, and the lack of resources compounding that. So to say the least, they are overwhelmed. The healthcare system is basically not existent. I would say, learn about the situation, about Gaza, learn about the people, what they're going through. Everyone has, I would talk about as a healthcare provider, everyone has their own skill set. If you think your skill sets are needed, and I think everyone's skill sets are needed. If you're a surgeon, if you're not a surgeon, if you're a medical doctor, or if you're a nurse, anyone who can come here will be beneficial, will help the people, and I strongly encourage everyone to consider coming to Gaza and help the needy people who are here.